We often think of plastic surgery as cosmetic, but it can be about getting your life back. Today, Dr. Christine O, a facial nerve reconstruction specialist with Dignity Health, shares how this work is changing lives. Welcome.
Thank you.
So I want to talk about some of the reasons people get facial paralysis. Some of it is congenital, there's Bell's palsy, stroke, and then sometimes there are bad consequences from facial plastic surgery.
Oh, absolutely. Unfortunately, with a deep plane facelift, the facial nerves are right in that deep plane, and sometimes, especially with secondary surgeries, the nerves can be injured inadvertently, and patients wake up after a facelift with facial palsy, which is a terrible reason to have.
Right, they went in wanting to look better, and now they have. Well, let's talk about Bell's palsy, which is, I think, more common than anyone knows.
Yep, absolutely. Bell's palsy is kind of a generic term for facial paralysis. It can be caused from stress, from pregnancy, from trauma, viral induced. So, any kind of flu, cold, even COVID can be a reason for Bell's palsy. I think oftentimes patients go to the emergency room thinking that they're having a stroke, and then they get referred to a neurologist, and the neurologist says, oh, it'll get better, wait a couple months. And I often see patients several months down the line saying it's not gotten better, or another complication of just having a Bell's palsy is something called a facial synkinesis too, where patients will try to smile and their eyes closing. And I don't know if you've ever met someone like that, but you're like, oh, why is their eye closing when they're talking?
I have seen that.
Yes, that's called a facial synkinesis, which is also something I treat and see a lot of.
What you're doing to address these facial paralysis, no matter what the cause, is incredible, because in some cases you're grafting a nerve from somewhere else in the body to the face.
Yes. So the gold standard for facial reanimation, everyone wants to be able to smile when they're happy. There's other nerve transfers where you have to train yourself to clench in order to move your face. So the gold standard is something called a cross-facial nerve graft. I borrow one of the sensory nerves from your lower leg. I connect it to the working facial nerve branch for smile on one side of your face. I tunnel it under the skin. I make a little incision under your lip, and then I reconnect it to the smile nerve on the paralyzed side.
You must have some incredibly grateful patients.
Oh, absolutely. It's so rewarding to see someone who had a total facial droop, and a couple of months down the line, when their nerve regenerates, they're able to move their face, and they're overjoyed, and I'm so happy for them.
And the work doesn't end with you, because often you can reconstruct a nerve, but there's still physical therapy to be done. You're talking about blinking, smiling, as you mentioned, other expressions, and many of your patients do physical therapy.
Oh, absolutely. At Dignity, we have a wonderful physical therapy team. We have one physical therapist, Ashley Green, who I am just so grateful for. She trained under Catherine Miner, who was our previous facial nerve physical therapist. And all my patients see Ashley. I trust her with everybody, and they also love her. And she is just as important as the surgery.
What is the age range of your patients?
At Dignity, I am able to see patients from about age 14 and then up to, I have patients who are 85 with facial paralysis that I offer treatment to everybody.
This is such incredible work that you're doing. Thank you so much. What's a good way for people to find out more information?
If you go to the Dignity Health website, you can find my name and my office number, and I'm happy to see anybody.
We'll also put that information up on our website, cw7az.com. Dr. O, thank you so much.
Thank you.
I feel like this is going to become